the JAMA Network.
More than a year ago, David Collins was in the hospital receiving his last treatment for kidney cancer when he had a heart attack.
It really didn't make any sense to me to start with. Why was I having a heart attack and I was in the hospital?
His physician, Dr. Michael Young, shows David the type of blockages that were found in his heart.
Right there, you see that blockage?
If there is a complete blockage and there is no blood getting to that part of the heart, that is an ST elevation myocardial infarction or a heart attack.
Also known as STEMI.
Inpatient STEMIs occur at a higher rate than we have previously thought.
Doctors George Stouffer and Prashant Kaul, along with their colleagues from the University of North Carolina, examined data from patients who experienced STEMIs at 303 California hospitals during a 4-year period. About 95% of the patients had their heart attack outside the hospital. 5% had a heart attack while hospitalized for a non-heart-related problem.
For patients who have a heart attack outside of the hospital, there's a very well organized and finely tuned protocol now for taking care of patients like this.
That includes using medications and a balloon or stent to open the blocked artery.
Patients who have inpatient STEMI are unlikely to receive interventional treatment. They received interventional therapy or balloon angioplasty only 20% of the time.
This study appears in JAMA, Journal of the American Medical Association.
They are generally older patients, they're sicker patients, they were less likely to go home, and they were more than 3 times likely to die.
We need to look at those systems for patients who have a heart attack in the hospital and take those patients who will truly benefit from treatment and get them treated in a rapid manner.
David, a busy farmer, is now back on the job, feeling much better and thankful.
I'm glad that it happened the way it did because I had some blockages in other places. Now that I've got that fixed, I just feel better physically than I've felt in a long time.
Catherine Dolf, the JAMA Report.